So the mission now started.
Hello. Hello, good morning. Good afternoon, everyone. Thank you for joining us today for this regional court webinar, which is titled, oh, we're having more guests in. Maybe just wait just for a quick minute. Okay, I think we can get started. So I was saying good morning, good afternoon, and welcome everyone. Thank you for joining us today for this timely regional webinar, which is titled Burdened by Disease and Undermined by Industry, Advancing Health Taxes to Reclaim Africa's Health Priorities. My name is Uleimatu Job, and I serve as the Afro Regional Coordinator for the Global Alliance for Tobacco Control, GATC, and I'll be your moderator today for this session. I am truly honored to be guiding today's conversation, which brings together key voices working across public health, tax policy, law, and civil society. So we have a dynamic agenda today that we will be sharing in the chat. You will hear a series of focused presentations followed by interactive discussions. Feel free to use the chat to introduce yourselves. So just to quickly go through the agenda, we will start by opening this webinar with Labram from Ghana. And then the experts will have presentations on different topics such as excise taxes and industry. And we'll go through some case studies from Kenya, Cameroon, and South Africa. And then an open session of Q&A. And then we'll be closing the webinar. Just to go through a few housekeeping notes, please stay muted unless you're speaking. And also feel free to post any questions or comments in the chat anytime. And the chat is also open to share any links, contacts, or resources. So let's begin with opening remarks. Labram is the Executive Director for Vision for Accelerated Sustainable Development Ghana, and a key figure in advancing fiscal justice and health policy reform in West Africa. So Labram, over to you.
Right, thank you so much, Ule, for this round of introduction. And can you hear me first and foremost before I continue?
Yeah.
Okay, great. So distinguished colleagues, government representatives, present here, policymakers, partners, fellow advocates, youth, and young people present in this webinar, as well as the media, and then, of course, our traditional leaders, because we have some of them present in this webinar. I wish to bring you greetings from Ghana and also from Africa, and also from the Vision for Accelerated Sustainable Development, as well as partners who are supporting us in this important and crucial webinar. It is indeed an honor and a privilege to host this crucial conversation about reclaiming Africa's health priorities through the advancement of excise tax, also known as health taxes. Some even call it behavioral change taxes, and then some also call it, health promotional taxes. Africa is at an alarming and turning point, and we are witnessing a silent, epidemic of chronic non-communicable diseases, i.e., cardiovascular diseases, diabetes, the cancers, and chronic respiratory conditions that are now accounting for over 37% of deaths in sub-Saharan Africa, according to the WHO. In Ghana alone, NCD, are now responsible for about 45% of all deaths. I know some countries are having more of these deaths, but of course, these are the recorded ones that we know of. I mean, we know that probably there are many of these deaths that are not yet recorded, especially in our part of the world. And the rate of premature mortality from these diseases is alarmingly very high. And permit me, Madam Chair or Moderator, to share with you a breaking news, from Ghana. The Parliament of Ghana passed the Ghana Medical Trust Fund. I mean, on Tuesday, just this Tuesday, 22nd July 2025. The objective of the bill is to mobilize resources to finance and support the provision of specialized medical care for the treatment of persons with chronic diseases. And chronic diseases here has been defined to include the NCDs I mentioned earlier. I'm talking about the chronic NCDs that we all know, the cancer, the diabetes, the hypertension, the strokes. Let me use the opportunity to commend the president of my country, Ghana, for this bold initiative, and the fact that this is an advocacy win for public health, I mean, for NCD and for people living with non-communicable diseases. I'm yet to see, a country probably in Africa where, I mean, a bill, or there's a law, specific law passed the parliament that is seeking to, reduce the untold hardship that people live with NCDs go on daily basis in trying to get care. So of course, so this happened, and obviously you could see that because of the challenges of non-communicable diseases, which is burdened by all of us, that's the reason why we are having this initiative in Ghana, which is passed and hopefully to roll out very soon to reduce the burden on people who have to, dish money into their pocket to advance care. Now, this is an opportunity for us as advocates, not only in Ghana, for earmarking of excise taxes on tobacco, alcohol, and sugar-sweetened beverages, as well as plastics, to be dedicated towards, supporting this fund for its sustainability. And I think that that's one of the reasons why we are here. And of course, excise taxes and non-communicable diseases are the reason why we are gathered here today, just so we're able to understand from all angles why it's important. Now, having said this, the root cause of NCDs is known. We all know about that. They are industrially produced, aggressively marketed, and strategically targeted. So I'm talking about tobacco, alcohol, and sugar-sweetened beverages, and of course, ultra-processed food, which mostly we don't, speak about. And the target has always been children, young people, and the vulnerable population. Now, these industries, while profiting immensely, are undermining the decade of progress that we have made on health equity and economic development. But we are not without tools. We are not without mechanism. Taxes, especially excise taxes on harmful products, remains the most powerful, cost-effective policy instrument, which are available to all of us. They reduce consumption, generate revenue, and also, more importantly, saves lives and deaths. Now, in Ghana, following the passage of the Excise Duty Amendment Act in 2023, we have seen tremendous progress. I will not belabor the points because a tax expert from Ghana is here with us today to share with us, how Ghana has made it, and then some few lessons we can learn from the Ghana example. Now, but it's important to know that a model, which was done with respect to health and revenue impact, gives some few highlights that I want to share with you. Now, it says that and the modeling projected that a 20% excise tax price on tobacco, will reduce consumption by 26.6% in 2023. That was the project that was done. It will generate 131 million Ghana cedi extra, and also avert about 34,600 deaths over a working lifespan. Similarly, for alcohol, a 20% price increase would generate 2.4 billion Ghana cedis and reduce consumption by 7.6%. averting 44,000 deaths over a century. And then for sugar-sweetened beverages, it will reduce consumption by 24%, raise revenue by 1 billion Ghana cedis, and then avert 155,000 deaths across a century. So it means that the excise taxes are very, very important, and they would work if indeed we put a premium on it. Now, having said this, this is why we are organizing, this forum, and we are calling on governments across Africa, and policymakers especially, on all policymakers across Africa, gathered in here, to maintain and increase the excise taxes level in line with WHO recommendations. So if countries have not yet, implemented excise taxes, we are encouraging them that it is working, and Africa has so many examples to share. We'll hear from other speakers. Earmark or refence portion of these taxes to finance health and non-communicable diseases and other, tobacco or alcohol-related diseases that we are confronted with. Then, finally, to say that we need to index, them to inflation if it's a specific tax. And then, most importantly, we must ensure that we stand firm, against industry interference. This webinar offers us the opportunity to unite us as civil society organizations, researchers, policy health experts gathered in here, and government actors, and the young people, as well as the media, for a stronger excise tax regime across Africa. Together, we must unmask the tactics that the industry, continue to bring to us, counter misinformation with evidence, and ensure that our policies reflect the true cost of action or inaction. Now, on this note, I wish to welcome all of you to this important webinar and wish all of us a very fruitful engagement. I thank you very much, and over to you, Madam Moderator.
Thank you, Lavam, for opening this webinar. And that is really great news that Ghana is putting forward such a bill. And I hope other countries in the region can also take example. Just a reminder for everyone to please mute their mic. So just like Labram has mentioned, NCDs are really rising rapidly with about 37% deaths that are accounted for in sub-Saharan Africa. And between 2018 and 2021, only 0.3% of the total government assistance for health really went to tobacco control and virtually none to alcohol and sugar control. So I think been and I really hope we can explore how Africa and our countries can use this powerful tool that we have, which is excise taxes, to fund health and really reduce NCDs. So without further ado, we will start with our first presenter, Dr. Alex Kambak, who is the Deputy Director at the Ghana Revenue Authority. He will walk us through Ghana's recent health tax reforms and regulatory shifts. So Dr. Kambak, welcome.
Thank you. Thank you very much. So if you can share my screen. Okay. Thank you very much. So I'm Alex Combat. I'm the head of the research and policy at the Ghana Revenue Authority. And I'm extremely excited to be part of this webinar to speak on understanding excise taxes from policy or regulatory perspective. If you can change. Can you go to the next slide, please? Yeah, so within the next 15 minutes, so I'll take you through the content displayed some introduction, rationale for excise taxes in Ghana, the tax administration itself, the policy-making processes, some success stories, challenges, recommendations, and conclusions. Next. Yes, so it is actually the responsibility of the government of Ghana to protect the citizenry against any health risk. So here we are talking about NCDs, which are usually associated with consumption of some harmful products. Now, one means of doing this is through imposition of excise taxes. And in Ghana, we have implemented some excise taxes on 1, alcoholic beverages, 2, wines and spirits, 3, tobacco, 4, carbonated drinks, 5, sugar-sweetened beverages, and then we also have flavored water and plastics. What are these for? It's actually to correct market failure for negative externalities and internalities. What this simply means is that prices of these harmful products or cost of the harmful products are not actually captured when pricing of these products. Next. Now, Ghana excise taxes hinge on 4 main pillars, and this has actually been the guiding principle for Ghana when it comes to excise tax implementation. What are these 4 pillars? The first one is to increase excise tax revenue, mainly to finance development priorities. 2 is to reduce overconsumption of harmful products. 3 is to reduce healthcare burden. You know, when it comes to these sicknesses, it got to do with some financial burden on government. So government wants to introduce or implement these taxes to reduce healthcare burden because eventually it falls on its shoulders. And 4, to reduce NCD risk. So these are the main 4 pillars when it comes to implementation of excise taxes in Ghana. Next. Now, excise tax implementation dates back to colonial period, and it has actually gone through a lot of changes. But one of the significant changes in recent Ghanaian excise tax history was the amendment of the Excise Duty Act 2014. So you can see the year 2014. And it was actually amended in 2023. That was major amendment that actually changed a lot of things and changed the face of administration of excise tax in Ghana. What was it for? 5 main reasons. The amendment was 1, to increase the rates of the excisable products. 2 was to mitigate the harmful effects of excisable products. 3 was to actually align the rates to Article 8 of the Chapter 4 of ECOWAS Protocol, where they talk about a specific tax of USD 0.2 per cigarette and then USD 20 per net kilogram of tobacco products. 3 was to introduce excise tax on electronic cigarettes and then electronic liquids. 5 was to introduce excise tax on sugar-sweetened beverages and some processed fruit juices. So this was the major amendment that occurred in the excise tax history of Ghana. Now, why do I say that? When you look on the screen, you could see the old rate and then the new rate. So the new rate means the amendment actually pegged or fixed the rate at this point, taking into consideration the old rate. So I'm going to take you through 8 tariff numbers and the rates that we now have. So tariff number 1, we are talking about mainly water. And here, the average rate for these products was about 17.5. Now you can see the rates were increased to 20% averagely. Tariff number 2, we had malt drinks. And here, the tax is actually, or the rates are based on the raw material content of the product. And the highest rate here was 17.5. This was increased to 20%. The middle range, or the next rate, was 10%, which was increased to 12.5%. And the least, which was 7.5, is now 10%. The next tariff is beer and then other alcoholic beverages. This is also based on the content of the raw material used. Now, the old rate was 20%. It increased to 47.5. Just look at the increment. And then we have the middle range, which was 12.5, increased to 32.5. And of course, the lower band rate is 10%, which is still 10%. The next is imported beer. That is tariff number 4. And this was also increased from 20% to 47.5%. The next tariff number is 5. We can go to the next slide. Tariff number 5 got to do with wines. And here you can see the old rate. It increased from 22.5% to 45%. Now the next tariff number, which is spirits, we had 10% or 20% averagely. And this also increased to about 50%. Now, when it comes to tobacco, we have cigarettes 175% of the ex-factory price. Currently, what we have is 50% of the ex-factory price as the ad valorem and then specific rate of 28 pesos. Now, we also had some electronic cigarettes and then liquids also introduced. So the last tariff number is on plastics. And here the rate was actually reduced from 5% to 10%, and the base was actually broadened. So please, that is why I said it was major amendment, because you could see the old rates and the rates we have now. The next, please. Next. Now, the policy making process, how did we actually achieve this feat? It was not actually a feat that was achieved on a silver platter. Now, we had 5 main key actors that were involved in the policy making process. We had the politicians, executive and the legislature. We had the industry groups, producers and importers. We had the bureaucrats, Ministry of Finance and GRA. And then we had civil society organization, then the academia. We had the VALD and then the VEST. They played a major role when it came to the policy making process. Now you could see that there was that political will for the changes. Now, we also had objections from the industry groups, but civil society groups, for instance, VALT, VEST, Advocating for Health Coalition and Ghana NC Alliance, lobbied Parliament and government officials for the passage of the new law. Now, the bill was submitted to Parliament in November, and industry groups came in to actually thwart the passage of the law. And that is why I say civil society groups had to come in strongly to lobby Parliament and then to come up with fierce fight, or to put up fierce fight to be able to get this bill passed. Now, they organized press conferences, issued press statements, held workshops, And even they demonstrated on the streets for the passage of the law. Now, the good news is that although the bill was submitted in November 2022, by March 31, we had a bill passed into law, and then the implementation started on May 1, 2023. So I think we have to give it up for the civil society groups. They did a yeoman's job to get this bill passed into law. Now, the policy-making process went through 10 phases. I'll briefly take you through phase one. There were some research related to the excisable products, especially tobacco. Now, these researches, the results were actually presented to Ministry of Finance and GRA. Now, phase two, we had VALT, that is one of the NGOs or civil society organizations fronting discussions with government of Ghana, Ghana Revenue Authority, and Ministry of Finance on the findings of the research on the harmful effects of the products that are actually not good for us, and then the revenue implications of these taxes. Now, phase three, GRA actually then made proposals to Ministry of Finance for changes, major changes in the law. Phase four, Ministry of Finance then sought cabinet approval. After accepting our proposals, they sought cabinet approval for it to be incorporated in the budget reading of 2022. Now they got the approval, and then phase five, it was incorporated into the 2023 budget statement. Phase six, then there was drafting of the excise tax bills, which we were all part of it. Phase seven, then we had parliamentary proceedings, and then the passage of the law. And then phase eight, then there was development of modalities and then strategies for the implementation of the act. And then phase nine, the implementation actually took effect. That was May 1, 2023. Now you can see the dates for all these activities. And phase 10 is what we have now. So it is about monitoring and enforcement of the Amendment Act. Can go to the next. Next slide, please. Now, what has been the successes of excise taxes in Ghana? Now, I have three columns. We have column one, okay, 4 columns. The year, we have the column one is the year. Column two, which is the green column, that is the excise tax revenue for Ghana. And it has risen from 272.52 million Ghana cedis to about 2.2 billion in 2024. When it comes to the non-sugar sweetened beverage tax revenue, tobacco revenue has increased from 41 billion to 227.21 million in 2024. That is 41 million to 227.21 million in 2024. Wines and spirits, the revenue increased from 2.81 million in 2012 to 62.55 million in 2024. So you have the last column there, that is the total non-sugar sweetened beverages. When it comes to the sugar sweetened beverages, the revenue has increased from 228 million to about 1.9 billion Ghana cedis in 2024. Next slide.
Sorry for the interruption, Dr. Combat. Just a quick reminder that we're running a little bit tight on time.
Okay, good. We also have some successes in terms of reduction in prevalence. So you could see that Ghana has the least prevalence when it comes to Africa, and that is exhibited in the figure that you can see. So whilst others are having 28%, Ghana has about 4.8. So this has been achieved through implementation of these taxes. Next slide. We've also had some success stories in terms of international assessment of our taxes, which has also been very successful. We also have increase in prices of the accessible products. So currently we are talking about beer price increasing from 5 Ghana cedis to about 11 Ghana cedis. And then we also have cigarettes prices increasing from 21 to actually increasing up to 21 Ghana cedis. And then we also have average cost per pack increasing from 14.12 to about 19 Ghana cedis. And then tobacco currently, the share of the tobacco in terms of the retail price is increasing. That is 45%. So we are actually getting closer to the WHO requirement of 75%. And then we also have increase in prices of some of the SSBs. You can go on. How many minutes do I have? Now we also
We're
have implement. Yes, please.
sorry, I was saying we're over the 15 minutes that were allotted, so
Okay, so
maybe if we can continue.
I'll just run you through. So we have
Thank
few
you.
challenges. One is the fact that the Ghana Excise stamp is not designed based on WHO Article 8 on the ITP. And then we also have tobacco industry players' involvement in or interference. We have illicit importation of the products, and then the specific rates are not actually adjusted to inflation. A few recommendations, and then I'll conclude. Go on to the next. So a few recommendations. So we recommend implementation of the track and trace system, automatic adjustment of the specific rates to inflation. And then we also suggest the tax be based on we also suggest the tax be based on the constituents of the product, sugar and alcohol content, mixed regime of the accessible products, and then some financial support for research. And then in conclusion, please. The next slide and I conclude. So one, Ghana has made efforts when it comes to reduction in consumption of these harmful products, and GRA has actually been successful in implementing the hybrid tax system in Ghana, and excise taxes have a significant impact on revenue, and we appeal to all stakeholders to come on board for us to have successful implementation of excise taxes in Ghana. Thank you very much. That is
Thank
the
you.
end of my presentation.
Thank you so much, Dr. Comeback. It was really a powerful overview. And then you've really shown that excise taxes are not only a public health measure, but it's also a really good strategy for, financing, and especially nowadays that donor fundings are really shrinking. So just a quick reminder that maybe we'll do the questions after all the presentations. We'll have really more time for an open Q&A after all the presentations. So without further ado, we will move on to our second presentation by Dr. Sundar Chisa, who is the program director at the WHO FCTC Knowledge Hub on Tobacco Taxation. And Dr. Chisa, please go ahead.
Fantastic. Thank you very much, Ole, and very big thank you as well to the vast team for putting this together. I think it's an excellent opportunity to really showcase the work that we do around health taxes and its importance. So shall I go ahead and share my slides, or do you already have mine? I tweaked mine a little bit, so maybe I should share. Is that okay with the programs? Oh, okay. Okay, let me share it. Thank you. Excellent. Just confirm you're seeing this. And it needs to be in presenter mode. Just give me a second.
You can see your screen, maybe just.
All right, here we go. All good? All right, so I was asked to basically speak a little bit about the distinction between excise taxes and other types of taxes, and to give some examples of some of the success stories that we're seeing on the African continent. So that's basically what I'll endeavor to do in the 15 minutes that I've been allocated. So let's dive right in. So what exactly are excise taxes? We've heard Dr. Combat talking about excise taxes. We've heard it mentioned by Labram. Basically, excise taxes are a specific type of tax that's targeted at harmful products. We've identified tobacco, alcohol, and sugary drinks during this meeting, but really it can be applied to things that also have environmental impacts. For instance, fuel, gas, and these sorts of things that are also subject to some kind of harm to the public or to the public good. They have different types of characteristics. They can be levied as a specific tax, meaning a per unit tax. So 100 CDs per cigarette as a tax would be considered a per unit tax. Whereas if you said something like 10% of the value of the price of the factory manufactured cigarette, then that would be considered what's called an ad valorem or a value-based tax. And in many cases, it's justified on public health grounds. We've heard Dr. Combat talk of what we call in economics externalities or internalities. These are negative impacts that are experienced as a result of the consumption of these types of products. And so there's a very specific reason why excise taxes tend to be implemented. In terms of the broader ecosystem of the different types of taxes, there are different ways in which you can classify them. So broadly speaking, I've presented two classifications here: direct taxes and indirect taxes. So direct taxes would be the taxes that you, for instance, as an employee, pay every month to the tax authorities. You have a pay-as-you-earn tax that you have that's deducted from your salary, and that goes directly to the tax authorities. You, as the taxpayer, are the one who is paying this amount. Companies have a similar thing. So corporate income taxes, for instance, would be paid directly to the tax authority from a corporate entity, from a firm, a company, and so on. On the other hand, you have what are called indirect taxes. So these indirect taxes are incorporated into a price. So if I was to ask any of you what the tax, the VAT or the sales tax amount that you pay on a packet of sugar is, nobody really knows that number offhand. You don't know that number, but you know the price of sugar, you know the price of milk. But within that price is incorporated an indirect tax. There will be VATs, there will be excise taxes, and many of the taxes that Dr. Combat, for instance, was referring to will be indirect taxes and will be incorporated into these prices. So they're indirect in the sense that you're not paying it directly to the tax authorities, but they are incorporated within the price mechanism that allows for the tax to be collected. So why are excise taxes particularly important in the African context? We've talked and heard a little bit about the health crisis that is currently ongoing. Labram referred to over a third of deaths that are currently being attributed to NCDs across the continent. But there are also other reasons why excise taxes matter. He mentioned the fact that we have a young and vulnerable population that is currently being aggressively targeted in terms of the marketing strategy by the industry. And I'm talking about tobacco industry, the alcohol industry, the food industry. All of these different industries have identified the young people on this continent as a viable market for their products. And so excise taxes act as a way to stem the tide of the consumption of these types of products. We heard as well from Ube as well, a slight comment about the changes in the fiscal environment in many countries where domestic resources suddenly are the main interest because countries no longer can access USAID money, for instance, or other types of ODA or official development assistance monies. There are declines in all of these different foreign assistance monies. So countries have to find ways to actually fund their various activities. And excise taxes present an excellent opportunity for this kind of revenue generation as well. The other aspect as well is the fact that excise taxes are the most cost-effective intervention in the global health policy repertoire of interventions. So, for instance, if you were to put together a mass communication strategy or a mass communication campaign on any of the products that we're discussing here, it takes an immense amount of money to put that kind of campaign together. It does not take as much money, though, to change a tax policy. It takes some amount of money. You put together all these coalitions, you make sure you're talking to the right policymakers, you apply the pressure where it's needed. But in terms of the effect that you have, it's a much greater effect in terms of reducing consumption of unhealthy products. And so the cost effectiveness tends to be much higher in terms of its impact around all of this. And so what do we actually know about how these taxes work? Well, we've learned quite a lot. Over the years, we've seen various documents that have been produced by different stakeholders working in this space. I've presented a couple of these here, but really there are several others even beyond all of these. And there are a few things that we've seen that actually work. The first is taxes need to be simple. They shouldn't be complicated and overly complicated to administer. That presents loopholes for various things. It reduces the effectiveness of the taxes. It allows the industry to be able to play around with the taxes and further reduce the effectiveness of the tax. It's difficult for tax administrators such as GRA and other administrators around the continent to implement and effectively administer these taxes. And so simple is much better. We also know that taxes should be, structured and implemented in such a way that they protect vulnerable groups that we've already discussed from initiating in terms of starting to use some of the products we've talked about, tobacco, alcohol, and so on, and to stop excessive use of these products as well. We've spoken a little bit about uniform and ad valorem taxes, and what we found in much of the work that's been done around the world is that uniform specific taxes are much better than ad valorem taxes. So if you have a unit tax, a tax that's based on the amount, the number of units and so on, it's much better than basing it on the value of the product. And of course, there's this need to regularly increase excise taxes, especially if we're talking about specific taxes. This has to be accounted for in terms of inflation and income growth to make sure that affordability is reducing all the time. But we also know that the industry is not sitting back, right? We're going to hear a little bit later in some of the presentations about how the industry has done some of these things. I've put a couple of some of the arguments that we've heard in the past about what claims the industry makes about the effectiveness of these taxes. They'll say it's bad for the poor, it kills jobs, it reduces revenue, it has no impact on health. These are just some of the claims that we've heard in the past. But we've been able to push back as well against these types of claims and present the reality based on hard science, based on research, based on interaction with various stakeholders, that in fact, it's not that excise taxes are bad for the poor. In fact, they are good for the poor. They benefit the poor the most by making sure that the poor are the ones that reduce their consumption of harmful products the most. It doesn't kill jobs. In fact, it shifts jobs to healthier sectors. So jobs are fungible. They can be moved from one sector to another. You don't have to stick to an unhealthy product. It also, we've seen just from the Ghana example that actually excise taxes result in a predictable increase in revenue. And this is proven by a lot of the research that we've conducted over the years, as well as some of the experiences that we've seen from countries such as Ghana and others around the continent and around the world. And of course, we are seeing that there is an impact on health. In many countries in the north, we've seen reductions in consumption, leading to reductions in NCD incidence cases, and that's why suddenly Africa becomes the main market for a lot of these products. One such country where we're seeing, we've seen quite considerable success, but hasn't been very much discussed in many contexts, is the case of Cabo Verde. So Cabo Verde is also a part of ECOWAS. And so this directive that Dr. Combat referred to, which was issued in 2017 by ECOWAS, where they basically encouraged their member states to implement what's called a specific tax component of roughly 2 US cents per stick, was also, Cabo Verde was also subject to this directive. What they did was in 2019, they implemented this particular directive and subsequently increased the specific component, as you can see here, in 2019. If I can just direct your attention to the table, if we're looking at tobacco, there's an ad valorem component and a specific component. The ad valorem component had been in existence and continues to be in existence, but the specific component, this 20 CVE per pack, was introduced in 2019. It stayed the same in 2020, it increased in 2021, and subsequently drastically increased between 2022 and 2024 in just the last year. And so the reason they've been doing this is they've seen the success that they've encountered in terms of both reducing the consumption of tobacco products as well as increasing their revenue. And I'll show that in a minute in the next slide. But the interesting thing about Cabo Verde is that they saw the success that they had in tobacco and decided in 2022 to do a similar thing for alcohol. So they not only had an ad valorem excise tax all the way up to 2021, in 2022, they decided let's also include a specific component for all our alcohol products. And that's what they did. And they've subsequently also been increasing that since 2022. And so you see a country that has translated the success from one product, the taxation of one product, to the taxation of another product because of the good impact that it has experienced over the period. And so these are two graphs that are showing some of what has been going on in the country. Credit obviously goes to the World Bank, who just recently produced this report, basically analyzing all of this data and seeing that the impact, for instance, on cigarette prices on the left here, we see that the prices were dipping all the way up to about 2020 thereabouts, and then start to increase over time. In terms of the revenues that they experienced, the dark blue component it represents the alcohol revenues, the light blue represents the tobacco revenue, and then the yellow would be the percentage of GDP over the same period. And we can see that when the taxes when the tax structures were changed, there was an increase in the revenue over time, right? 2018 to 2019, there was an increase. 2020, we know what happened there. That was obviously COVID. But since then, there's been some recovery in 2021 and a drastic increase in 2022 to 2023, according to the latest figures. So obviously, this has been a very successful implementation of these taxes for Cabo Verde. And they are naturally interested now in also implementing similar changes in SSB taxation in the country. So what's the big lesson? Well, excise taxes are a public health tool first, and they're a very good public health tool. It's important to keep that in mind. And they're a fiscal tool second, but this doesn't mean that we completely ignore the revenue aspect, because that's also an important part of what we can get from excise taxes. We also know that design is an important part of this. If we do not have a good design, a simple, usually a uniform specific tax for most of the products here, then we're going to have a difficulty in getting the benefits of these taxes. They need to be inflation adjusted at the very least, and they need to be broad-based. We also know from the lessons we've seen so far from many countries around the world and on the continent is that industry pushback is predictable, but it is also manageable. because we have the evidence. It is a matter of presenting this evidence to the right decision makers to be able to make the decisions appropriately. And we've seen that as well, even just coming from Dr. Combat's experience and vast experience with all the presentations and the evidence that was presented to policymakers there. We know that framing is also extremely crucial. We want to link all of this to youth protection. We want to link it to the NCD burden that we're currently experiencing. And increasingly, we're seeing that there's need to also link it to sustainable financing, especially within the health sector as well. Naturally, expertise in terms of civil society and partnerships with the media, with technical experts must be done and must be aligned quite early in the process as all of this is being implemented on the continent. So that's my presentation, and I hope we can have lots of discussion in time to really delve into some of these topics as well as we get to the rest of the presentation. Thank you very much.
Thank you, Dr. Pisa. It's really critical, as you say, to remember that all taxes are not created equal. And then, these excise taxes are uniquely effective when they're designed with public health in mind. Yet, as the tobacconomics countries are very well still below the recommended 70% tax benchmark. So I think, this presentation was really helpful. So just in the sake of time, as a reminder, we have about 30 minutes and we're hoping to have a Q&A session just after this third presentation that will come from Akinbode Oluwafemi, who is the Executive Director of CAPA. So Bode, the floor is yours.
Okay, thank you so much. I think you can put up my slide. I'm quite fortunate that the two speakers had, in one way or the other, touched on what I will be speaking on. So we'll gain some time. Can you put up the slide, or do I share from here? Okay, thank you. So first slide, please. I think the two speakers have spoken about why we need public health taxes. From the two former speakers. The first slide, please. Hello. Oh, there seems to be a snag. All right, okay. So we realize that these taxes are not just the regular taxes, they are a response to products that cause public health harms. They're products that are not, if you use them as maybe recommended by the producers or consume them the way, we just ordinarily consume them, they inflict health harms on the people. And these taxes are correctional and also to address some of those harms. And that if we impose these taxes, then we can reduce the volume of consumption of those products and then reduce those public health harms that they cause. The last speaker has spoken that this is a win for the economy. Why? Because revenues for government will go up, citizens' health will improve, productivity will improve, and then overall, some money that have been spent on these harmful products will be used in other sectors of the economy, and there will be, net gains in the economy. And then again, it is good for the citizen because the citizens spend their money wisely. However, in going to how they undermine, we just basically go to how industries have responded when harmful products are being regulated or when taxes are being imposed on them. And like we've all know, the first thing they do is to deny. They would deny there is a linkage between their products and public health. They would even deny that taxes work. They will tell you that what we're supposed to be doing is to go on public education. And once they see that the momentums are high, then they want to dilute whatever laws that would be imposed by government or by regulators. And when they fail, then they look for how to delay those taxes. So what we all commonly now call the industry playbook, which is to deny, dilute, and delay, has been at play since we've started either the tobacco campaign, trans fats, and of recent, the sugar-sweetened beverages campaign. And what are the arguments? Some of them, Dr. Last speakers has alluded to them. Next slide, please. Oh, they will say you will ruin the economy. Oh, African economy are so fragile that we cannot at this point impose those kind of taxes. That's one of the key messaging they've used across the continent against public health tax, that government should be promoting direct investment rather than make the environment should be made accommodative to businesses rather than imposing taxes. Of course, is also the cry about job losses, that this will create job losses. There are tons and tons of evidence we've proven to them that this does not cause job loss. The money spent on these harmful products will be spent on other productive sectors of the economy. Or they will say, they can sometimes say it will lead to smuggling, and that government should ensure that they protect local manufacturers. Well, it's the duty and responsibility of the government, the sovereign right of governments to actually tackle smuggling. And we've seen in several cases, particularly the tobacco industry, that they actually aid those smuggling, and that they use smuggling actually to introduce products into certain markets, particularly to make it cheaper, and then to create the taste for that product before they officially then move in to sell. In Africa, they have threatened our government several times that, look, if you impose these taxes, we will flee, we'll pack our bags and go. The interesting thing is that for people in government are beginning to see that these are just lies, they don't live because of these taxes. And then for some of us campaigners, public experts, they say, oh, you are actually pursuing a foreign agenda. It's, they are foreign sponsored. And the argument has always been that we need to protect our own citizens, just like the way other governments around the world protect their own citizens. Next slide. So what we have observed since we started this campaign, I'll just speak to a few of them, is that of recent now, we've seen an upsurge of multiple fronts. So the industry no longer speak themselves. They create a lot of front groups. And we've seen recently a so-called independent think tanks. In Nigeria, for instance, there is a new one that is called Think Business Africa. We've not been able to establish any link between this so-called Think Business Africa and the Think Business in Kenya. We're actually trying to our colleagues on that. We do have what is called the Manufacturer Association in Nigeria. This is an umbrella group of the manufacturers that push industry agenda. We should also look out for the chambers of commerce, and then sometimes they use farmers groups. Some of these farmer groups, if you dig deeper, sometimes are actually fake farmers. They are white-collar farmers, not the farmers that get their hands soiled, that they group together to make noise and do media campaign for them. But we should also be on the lookout for false economic studies these days, because we've seen all manners of researchers coming up either in tobacco control, pushing the the novel products, new products, narrative, um, and as well as in the sugar campaign, where they will come up with so-called studies that shows that actually a country like Nigeria is not consuming enough sugar, despite the fact that we are number 4 in the consumption of sugary drinks in the world, and cases of NCDs are rising. They do all these in order to confuse and dilute our messaging. Next slide. What we have also observed, next slide, please, is that the industry have started using lobby at the topmost level of government. And this is very worrisome on our continent because we have weak democracies, weak institutions, weak structures. They go to very top level of government and with promises about, oh, we're going to bring this huge amount of money to Ghana. So, and this tax you want to impose might jeopardize these direct investments. And they offer perks and holiday trips to parliamentarians, policymakers, and the rest of them. And so sometimes too, they use this to even create problems among government institutions. At a point where a very prominent, or will I say, strong regulatory agency in Nigeria called the Federal Consumer Protection Agency was about to impose, or had just imposed, a fine of $100 million on Coca-Cola for false marketing. Boom, we saw the CEO of Coca-Cola in Nigeria having almost like a private meeting with the president of our country. And at that meeting, Coca-Cola made the promise of $1 billion direct investment. And why it's also very important sometimes to monitor the industry is that they also lie a lot. Next slide. At this meeting, we were discussing increase, the mood in the country is to increase the current SSB tax rates. And then Coca-Cola was being fined. And then they came and then they promised $1 billion. It was supposed to be $1 billion. That's a lot of money. It was supposed to be huge media for Coca-Cola and to have huge leverage. But one thing we did was that we did a lot of research and we discovered that Coca-Cola had made similar promise to previous governments 3 times. The figure didn't change, 1 billion. Anytime they want to run into a problem, they will rush to Nigeria and promise 1 billion. And we basically issue a statement to say this was audio investment. In Nigeria, when we say something is audio, it means it's fake. It's just voice that is not backed by anything. This statement took the wind off their sail. It actually pushed the government to the defensive, and the government knew actually that they were actually being deceived by Coca-Cola. Next slide. Part of what they have used in Nigeria is litigation. There is the Nigeria Employers Consultative Association, NECA, that actually sued the Nigerian Customs over the collection of the Nigerian SSB tax. And their argument in court was that the final order to collect that tax was made by the minister rather than the president. Well, I'm not a lawyer, but I also do understand that the minister is an aide of Mr. President and that it can be delegated. But unknown to them, litigation was actually premised on an old law. The new Customs Act in Nigeria actually specified that the minister can actually directly impose taxes on certain products. But whether they know or not, part of what they wanted to do, though they failed, was to use litigation to delay the enforcement of the act. So speaking to that delay that I spoke about earlier. Media attack is one of those things that we should all be ready for in this. They've done attacks on the taxis. It's going to cause problems. It's dangerous. It's harsh. They've written articles against, let's say, NGOs like ours. Sometimes even want to go personal attacks. The only thing I used to tell people is, please stay focused on the subject matter. Don't be drawn. They want us to be diverted. They want us to divert our attention. That is one of those tools that they have used that we should always be mindful of. One more thing I'd like to speak to is the use of digital media influencers. This phenomenon is becoming very rampant now across the continent. We do know digital media influencers have huge followership, and now it is now the era that the industry use these people to push narratives. Next slide, you will see a digital influencer here called Wura Ola of Lagos, very popular. And what she wrote there is basically that, oh, of all the problems in Nigeria now, it is the soft drinks that should be the Nigerian government's problem, and that so we can no longer enjoy quote and unquote soft drink. So they deploy these people in order to technically want to shape the narratives outside. In conclusion, I must say that one of the core issues they've done, particularly the food and beverages industry, is to normalize, to want people to think that this is normal, this is food. And so, unlike tobacco, we need to strengthen the messages that there are certain foods that are harmful. And so in doing that is that we must incorporate provisions of Article 5.3 in FCTC across our policies on products with public health harms, be it food or whatever. I think it's a time for us to look at regional cooperation on public health taxes. I mean, the AU taking a regional position of this. And as we've had this webinar today, to continue to build this community of resistance to industry pushback, we'll continue to see it in diverse form. It is a time for us to look at messaging public health tax, healthier lifestyle, healthier diets, less disease, and a healthier Africa, so that everybody will understand why all these taxes are extremely important. Thank you very much.
Thank you, Akinbode. So just as highlighted in your presentation and also in the latest WHO report, tobacco taxes really remain one of the industry's top targets, and their scare tactics, just like the smuggling you mentioned, regressivity, job loss arguments, are really all part of their coordinated strategy to really stall the reform that we're trying to make. So we really have about 10 minutes left. So rather than going directly to the Q&A, I propose that we move on to the case study. We have today with us Celine Alwar, who is the CEO of the International Institute for Legislative Affairs in Kenya. Celine, welcome.
Thank you very much, Uli. So I see time is spent. So how many minutes do I have?
Not really trying to rush you, but maybe if we can have about 5 minutes tops, just so people have time to ask maybe questions, and then we can go through the couple questions in the chat.
Thank you very much. That's okay. And good afternoon, good morning, everyone. And thank you to Labram and the VAST team for convening this webinar. So I'm going to share just briefly. There's quite a lot to share from Kenya in terms of our experience with excise taxes and the industry pushback and what we've done, but I'm just going to highlight a few in the interest of time. So I think, as has been shared by former colleagues here, industry interference in taxation is historic. And for Kenya particularly, we have documented this going back to the 1990s, when, BAT has lobbied government on many occasions to either have, taxes reduced or the ceilings changed in exchange for either supporting government investment projects. Actually, there is a housing program in Kenya that was built by BAT, and in exchange, they got a few perks, including exclusive classification of tobacco growing areas. But maybe I can just share one most recent case that we've had, which is an attempt that was made by BAT in 2020 to request for a tax holiday for putting up a plant to manufacture oral nicotine pouches. This was in 2020. And the justifications they gave, as always, has been shared by Zunda and several others, is that, this is going to provide foreign direct investment to the country and, in creating employment and providing more revenue for government. But this was a clear violation of the FCTC Article 5.3 and our Tobacco Control Act. And we raised these concerns. We, in collaboration with other CSOs in the country, spoke strongly against this, and the tax holiday was not granted. Also, just is similar to what has been shared before in terms of the tactics that the tobacco industry in Kenya uses against the tobacco tax, is the narrative around illicit trade, the narrative around investment. Last year, BAT reported that they spent up to $75,000 in an investment program for development of youth programs in rural parts of the country. I mean, when government hears such a thing, it's very enticing. These are just examples of how, the industry pushes the narrative of illicit trade, and of course that it hurts the economy, and government is losing a lot of money in revenue. But interestingly, just a couple of weeks ago, Kenya Revenue Authority reported that they're losing billions of shillings in unpaid taxes. And the topmost, if I can call them, guilty companies were alcohol was leading, and then tobacco was leading in not remitting taxes. That for the past 12 months, Kenya Revenue Authority has lost a lot of money from unpaid taxes, and this is through not selling products or not affixing excise stamps. So whereas the excise stamps are issued by Kenya Revenue Authority and they're supposed to be placed on the products, then they are not. It means that, and this I think proves through the narrative that, we've had the argument that the industry itself also participates in illicit, in selling of products that are not paying taxes. So the tax stamps are there, but KRA cannot account for them. Lastly, now just beyond tobacco, I think for other products like sugar-sweetened beverages, you'd be surprised that the excise tax for the rate that Kenya charges on sugar-sweetened beverages is 14 shillings per liter. Now, 14 shillings, I tried to convert that in USD, it is 0.11. I don't even know whether that's a cent or less than a cent. That's just a slap on the wrist. It's absolutely nothing. And this is the rate that has been applied for over almost 5 years. So what does that tell you? This is, because of the strong lobbying by government. And I like what Bode said, the example he gave, that the industry has the reach of the topmost, does lobbying and advocacy at the high level. And that's the case also here in Kenya. In fact, in the last government administration, our president then, Uhuru Kenyatta, would hold breakfast meetings, quarterly breakfast meetings with the industry, or the business community, how it was called. And these were opportunities for the industry to speak directly to the president and, put forward the agenda. So that's a challenge to us as CSOs, that we also need to find our way up to the top, be able to have the ear of the president. Lastly, the other tactic that we've seen is use of front groups, which is very common. So the tobacco companies, when they are talking about taxes, they will rally associations that represent bar owners, associations or associations that represent retailers, and even bringing the other companies, the other manufacturers from alcohol, from beverages and all that, to just amplify their voice. And this also is a challenge to us, that we need to make health taxes not a single agenda issue, because when we look at listening to what Dr. Zunda shared and all the other colleagues, that these taxes are actually helpful to health strengthening, system strengthening. So when we rally together and look at these issues from the perspective of NCD control and health system strengthening, then you're also able to kind of widen the tent, bring in more people, increase our voices, and be able to provide a stronger justification why these taxes are important. I still had more to say, but I'd like to stop there in the interest of time. Maybe we can discuss more during the Q&A. Thank you.
Thank you so much. So really, regardless of all these challenges, we can note that Kenya has showed a really strong momentum on anything that is alcohol and tobacco taxes, and it's really thanks to our work and the work of all the CSOs that we can see all this progress. So I think we can now open the floor for the questions for based on the three presentations that we went through. We may go a little over time, but I hope that we have time maybe to answer just a couple of those questions. We have had a few in the chat, so maybe we can start with those, and then if time allows, anyone else can feel free to add more questions in the chat or just raise their hand. So the first question that we had in the chat is from King Hasaki, if I'm saying the name correctly. So does Ghana have a finance/revenue law that allows the revenue from taxation to be routed from the Department of Treasury to the relevant ministry for usage for the purpose of service delivery? So maybe I think that's a question for Dr. Comeback. Hello? Hello, can you hear me? Hello?
Ulay, we can't hear
I
you.
just wanted, I wanted a question again for Ghana.
So the question was, does Ghana have a finance/revenue law that allows the revenue from those taxes to be routed to the relevant ministry?
So I can go ahead.
Yes, please. If we can just go through answer really
Okay, so
quick. Thank you.
all right, so Ghana has a law. So when you look at the Ghana Revenue Authority Act, that is 2009, that is Act 791. The Act 791, when you look at Section 3, it instructs GRA to collect all the taxes, and then the taxes should be paid into the consolidated fund. Now, when the tax revenue is paid into the consolidated fund, there's also a law, that is the Financial Management Act, and that allows Ministry of Finance to allocate the funds based on budgetary requirements of the various ministries, agencies, which in this context includes the Ministry of Health and then all agencies under Ministry of Health. So that is how it actually works. So all taxes collected, the revenues are supposed to be paid into the consolidated fund based on GRA Act Section 3. And then when the funds get into the consolidated fund, there's also a law that allows Ministry of Finance to allocate the funds to the various ministries and agencies. So that's how it works. Thank you.
Thank you, Dr. Kamba. I see a hand here, Sefa Ikpa. You can hear us and you do have a question. Please go ahead. Hello, Sefa. If not, maybe we can move on to Prince Adomako. If you have your hand raised and you have a question for us, please.
Okay, thank you very much, Madam Moderator. I hope I can be heard.
Yes, we can hear you very well.
Okay, all right. I wish to thank all the presenters for that comprehensive presentation. I realize that all three, I think four of them, they all touched on the essence of these taxes, that they made a point that there is a health component and then the revenue generation component. And I like the way the second presenter put it. These excise taxes are first for serving as public health tools, and then second as fiscal policy tools. Dr. Combat, it takes me to the first presentation by Dr. Combat. Now, he took us through the comprehensive processes that were involved in developing the policy or the reform. And then he emphasized specifically on the Ministry of Finance and then the GRA, their involvement, and how this whole thing was initiated by academia and then civil society. And as already established, if this is first serving as a public health tool, it didn't really come prominently to me the level of involvement of the Ministry of Health in all these processes. If health is actually the key component, what was the level of the Ministry of Health in the development of the policy document or the revenue reform process? And then two, the same to Dr. Combat. If these are for to protect the health of the public, how are the revenues applied? Labram Musa mentioned the Mahama Care. Are there specific clauses or something that dedicate these funds that are generated to health promotion or rehabilitation of people that suffer from consumption of these unhealthy commodities like tobacco, like alcohol? So I would like to receive the responses from Dr. Combat, the level of involvement of the ministry in this whole processes and how the funds are applied to health promotion activities or rehabilitation of people that suffer from these unhealthy commodities. Thank you, and over.
Okay, so thank you very much for the question. It's a very good question. So the first one relates to the policy making process. So for the policy making process, it actually started, when you look at my thesis, it actually started with Vest carrying out a research, and that is where it actually started. Now, I'm very certain that when VALD conducted the research, they would have sought your input into the report. Now, what happened was, when the report was finalized, a presentation was made to GRA and then Minister of Finance. So Mr. Labram is join us and he will confirm this. So the findings were made to GRA and then the Ministry of Finance. I'm talking about the presentation. Now, when the presentation was made to GRA and then Ministry of Finance, we saw the need to actually incorporate this into the budget statement. And so we took it from there after the presentation was made to us to actually incorporate this into the budget statement. And then subsequently, the Ministry of Finance sought cabinet approval, and then this was incorporated into the budget statement. So in terms of involvement, I'm very certain that the civil society organization that is involved in this contest, and then even the academia would have actually sought your input in the finalization of the report. So you were not completely relegated. I'm sure you had inputs into the report, and it was the report which was presented to GRA, which subsequently was incorporated into the budget statement. Now, the second one got to do with how the revenues are actually applied. So when you listen to me, what we do is we have a system that collects the taxes. So we call it GITMIS. That is a Ghana Integrated Tax Information Management System. So all health tax revenues are actually got through this system. So all taxes are paid through this system. Now the system is supposed to transfer the funds into the consolidated fund within 24 hours. So all revenues accruing from the excise taxes pass through the GITMIS, and then within 24 hours, it gets into the consolidated fund. Now, when it gets into the consolidated fund, I have to assure you that one of the ministries that receives highest budgetary allocations in terms of government revenue is Ministry of Health. When you rank the ministries in terms of budgetary allocations, I think second or third, we have currently about 60 ministries. I think first to third, you'll find Ministry of Health there. Why? Because government sees the importance of this ministry, and then the health burden in terms of the non-communicable diseases, and then in terms of infrastructure. And so government allocates a lot of funds to this ministry. Don't forget the ministry also has even agencies, Ghana Health Services and other agencies that will actually also need the funds. And so that is how the funds are allocated to the ministry. And then the ministry will then do the allocations in terms of the agencies and then in terms of how they want to spend their money. But don't forget that even before the Ministry of Finance actually allocates funds to Ministry of Health, they will receive a budget from Ministry of Health of its total expenditure for the following year. And based on this, the funds are allocated. So the Ministry of Health has the opportunity to capture all NCDs, all the related health issues, infrastructure into the budget. And this budget is sent to Ministry of Finance. And based on this, Ministry of Finance allocates the funds. We don't actually have a dedicated fund. We had a dedicated fund for the plastics, but that is cancelled. But currently, we don't have a dedicated fund for NCDs or whatever. But what I know is that Ministry of Health receives a lot from Ministry of Finance, and that is how it works. Thank you very much. I hope it helps.
Thank you. Thank you, Dr. Kambak. So right now, I think we have just about 5 minutes. I see Felicia Dunso has a question, and can go on with this question, and then we can wrap up.
Okay, good morning, everyone. Please, can you hear me?
Yes, we can hear you.
All right. Thank you very much for the opportunity. And I also want to congratulate the presenters for a very detailed and elaborate presentation. My question is very simple. In the first presentation, I noticed that among the beverages or items that are taxed, water is also taxed. And the increments, I mean, the old tax and the current ones too, I saw an increase in the rates. I just want to find out what the rationale is for including water as part of the items that should be taxed. Of all the things we would want people to consume, we would want them to consume water compared to any other product, beverage product. So why is water also being taxed? And I mean, it's also making it a disincentive for campaigns on improving water consumption, because it's like water is equally expensive. So why not just buy any beverage, I mean, any drink, if the rates are similar? So I want to find out why, and if something can be done about it, how do we go about getting water de-taxed, I mean, reduced, the taxes on water reduced for public health? Thank you.
Okay, thank you very much, Madam. It is a very important question, and I share in your concern, and many have also raised this concern. Now, if you listen to me very well, I said the responsibility of the government is to take care of its citizens in terms of the product that they consume. Now, these products, I must say, are not only based on the content, but even the container in which these products are found. Now, Madam, you bear with me that we have a serious problem in Ghana when it comes to plastic management. So please, the tax is not on the water itself. The tax is actually based on the container, which in this case or context is the plastic bottle. So that is where the problem is. And you could see that the rate was increased from 17.5% to 20%. And the reason is simple, not the content, but the bottle itself, which is plastic, and we are having issues when it comes to managing plastic waste. So the tax is on the plastic bottle and not the water itself. Thank you very much. I hope it helps.
Yes, thank you, Dr. Kamba. Just for the sake of time, we've really went over. I know the discussion is really interesting, and then hopefully we have another occasion if that and that will organize another one. I think it's really something that is worth doing. So I'll take it over to Labram maybe for the closing remarks. Labram, over to you.
Right. So thank you so much. Thank you so much, Ole, for helping us to moderate this important webinar, and to also say that I wish to thank the presenters, but more especially those who stayed on. I mean, from the time we started to now. Let me also mention the fact that we are happy to come back to you with another exciting regional webinar. This is the second one we have. This is the second webinar we have organized this year. We are hoping to have another one before the end of the year, working closely with our partners. And then also we would put together a report and work with partners and supporters and share with our regional blocs in Western Africa, Southern Africa, Central and Eastern Africa, as well as the UN. for consideration in, in the formulation of, policy to mainstream excise taxes as a key, component, of health, so that we don't distinguish, taxes completely from health. And I'm happy that we've got the opportunity to understand the distinction between excise taxes and then other taxes, so that we don't mix them together. The industry, mostly you find them trying to, lump the two together to confuse everyone. So I'm happy that this clarity has been brought to our attention. We are also aware of the ongoing negotiation of the political declaration on non-communicable diseases and the mental health at the United Nations in the lead up to the UN high-level meeting on NCD in September this year. And we are getting signal, about the weakness of the language or the text on health taxes specifically. And I'm happy that at least we've been able to convene this meeting, looking at it from the African context. And so we are happy to advance efforts, towards ensuring that we further make, some recommendations and working with the Global NCD Alliance, and then also with the Movement International. We are happy to work with other partners as well. If you are interested, just so we can send a strong signal that we are not so much happy about the text, and Africa stand to be on the loose side if we don't get strengthened excise taxes with respect to tobacco, alcohol, and sugar-sweetened beverage. And then, like you heard from the speakers, the industry, are using, taxes to, and other argument to water down certain key policies. So, but I would like to mention some, just acting the speakers once again. So, we are thankful to Mr. Akim Bode, Matthew Oluwafemi, the Executive Director for Corporate Accountability, and Public Participation Africa, CAPA. Thank you so much, sir, for your time. Mr. Lin, Executive Director, Chief Executive Officer for International Institute for Legal Affairs, for your insightful experience. Let's combat, and we can't thank you enough. And we are grateful for your contribution, and then your continued support to efforts on alcohol, tobacco, and then sugar-sweetened beverage taxes in Ghana, and I think even beyond. You are a resource we can always rely on. And then also to Dr. Zunda, we are grateful for bringing us a comprehensive report from the WHO, and then also sharing these insightful, examples, to us. And of course, let me also thank Sharon, though she wasn't able to come, and also Mr. Ferdinand, who could not also join on the call. And then to you, our moderator, we are grateful. For your support and taking the time to moderate this session. We want to thank other partners like the Global Alliance for Tobacco Control and the Movement International. For their kind, collaboration and support. Throughout, efforts around tobacco and alcohol in Africa, and to our cherished, participants, who have stayed on throughout the webinar. We are grateful. In conclusion, let me say that every dollar earned through excise tax, every life saved through reduced consumption, and every policy upheld against corporate interferences is a victory for public health and the development of Africa. Indeed, Africa must stand, to avert, the problem that we are facing on non-communicable diseases. And in fact, we can do this through health taxes. Let us stand together. Let us act boldly, and then let us reclaim our health priorities. Through, effective taxation, as was mentioned by Dr. Zunda. Indeed, not all taxes, but taxes must be very, very, very simplified, and and very, the most important one, not just any other taxes. So on the inside, thank you very much, and hopefully we'll reconnect again. Over to you, Madam Moderator.
Thank you, Labram. So really, this conversation has made it clear that advancing health taxes is not only urgent, but it's really also deeply a complex and political issue. So thank you to all of our speakers for your insights and also to everyone who joined today. We look forward to continuing this conversation in the next session of this webinar series, hopefully, so we can dig even deeper. We can be deeper into strategies and then the solutions. So thank you once again and see you next time.
Bye-bye.
Bye. Bye.
Bye-bye.
Bye.
Thank you, everyone.
Bye.